I've been working as an intensive care unit nurse for 15 years, and I thought I understood the boundaries between life and death. I was wrong. What I'm about to tell you happened 3 months ago at Mercy General Hospital in Phoenix, Arizona, and it's the reason I just submitted my resignation letter this morning. My name is Daniel Torres, and I've been a critical care nurse since 2009. Mercy General is a 600-bed teaching hospital with a 40-bed intensive care unit that serves the greater Phoenix area. We handle the sickest patients, the ones hanging on by threads so thin you can barely see them. In 15 years, I've seen people come back from what should have been certain death, and I've watched others slip away despite everything we threw at them. But I've never seen anything like what happened with room 314. It started on November 18th, a Tuesday night that began like any other. I was working the 12-hour night shift, 7 in the evening to 7 in the morning, in the medical intensive care unit. My assignment that night included 4 patients, all critically ill, but none as complex as the man who arrived at 11:30 that evening. The patient was a 42-year-old construction worker named Thomas Kellerman, who had suffered a massive heart attack at a job site. By the time the paramedics got him to us, he had been down for nearly 8 minutes. 8 minutes without a pulse, without oxygen reaching his brain. In medical terms, that's an eternity. Dr. Ashley Vasquez, our night intensivist, met the paramedics at the door. She's been running our intensive care unit for 12 years and has probably seen more death than anyone should. When she looked at Thomas Kellerman's chart, I saw her expression change in a way I'd never seen before. "Daniel," she called me over. "We're putting him in 314. Get the family room ready." That was code. When Dr. Vasquez told you to prep the family room, it meant we were about to have a very difficult conversation with the patient's loved ones. Thomas Kellerman wasn't expected to survive. The paramedics had managed to get his heart beating again during transport, but the damage was extensive. His initial heart rhythm test showed massive damage to the left ventricle, the heart's main pumping chamber. His blood pressure was barely detectable, even with maximum doses of medication to support his circulation. Most concerning was his neurological status. He was completely unresponsive, showing no reaction to painful stimuli. Brain death protocol? I asked Dr. Vasquez as we got him settled in room 314. "Not yet," she said, "but probably within the next 24 hours. Thomas Kellerman's wife, Jennifer, arrived about an hour later with their teenage daughter, Emma. I've had to have these conversations with families hundreds of times, but it never gets easier. Dr. Vasquez explained the situation with the kind of clinical compassion that comes from years of practice. "The next few days will be critical," she told them. "We're doing everything we can to support his heart and give his brain time to recover. But I need you to understand that 8 minutes without oxygen causes significant damage." Jennifer Kellerman was a small woman in her late 30s with prematurely gray hair and the calloused hands of someone who worked hard for a living. She held her daughter's hand while Dr. Vasquez spoke, and I could see her trying to process information that no one should have to hear. "Is he suffering?" she asked. "No," Dr. Vasquez assured her. "He's not conscious and he's not in pain." That was Tuesday night. For the next 3 days, Thomas Kellerman remained in a deep coma, maintained on life support with no signs of neurological improvement. His heart function showed some marginal improvement with aggressive medical therapy, but his brain showed no activity beyond the most basic reflexes. On Friday morning, Dr. Vasquez ordered a brainwave test, a procedure that measures brain electrical activity. The results were what we expected but hoped we wouldn't see. Minimal brain activity, consistent with severe oxygen deprivation brain injury. "We need to have another conversation with the family," Dr. Vasquez told me. But that conversation never happened, because at 2:17 in the afternoon on Friday, November 22nd, Thomas Kellerman opened his eyes. I was checking his ventilator settings when I noticed his eyelids flutter. At first I thought it might be a reflex, the kind of automatic movement that can happen even in patients with severe brain damage. But then his eyes opened fully, and he turned his head to look directly at me. "Dr. Vasquez," I called, trying to keep my voice steady. "Room 314. She arrived within minutes, along with Dr. Matthew Chen, our neurologist who happened to be making rounds. Both of them examined Thomas immediately, and what they found defied everything we knew about brain injury recovery. Thomas Kellerman was not only conscious, he was alert and oriented. He knew his name, he knew where he was, and he knew what had happened to him. More remarkably, he remembered everything that had occurred during the 3 days he had been in a coma. The tall nurse with the beard checked my blood pressure at 4:15 this morning, he told Dr. Vasquez. And you told my wife yesterday that my heart function was improving, but you were still worried about brain damage. Dr. Vasquez and I exchanged glances. The tall nurse with the beard was Gregory Walsh, who had indeed checked Thomas's blood pressure at 4:15 that morning. And Dr. Vasquez had used those exact words in a conversation with Jennifer Kellerman the day before. "Mr. Kellerman," Dr. Matthews said, "you've been unconscious for 3 days. You couldn't have heard those conversations." "I heard everything," Thomas replied. "I heard every word. I just couldn't respond." Over the next several hours, Thomas demonstrated that he had somehow been aware of everything that had happened in his room during his coma. He knew the names of all his nurses. He could describe conversations between staff members, and he could recall specific times when procedures had been performed. Most unsettling, he knew things he shouldn't have been able to know. He described conversations that had taken place in the hallway outside his room. He knew that Dr. Vasquez had received a phone call about her daughter's soccer game while standing at the nurse's station. He knew that I had eaten a sandwich in the break room at 3:30 in the morning 2 days earlier. "This is medically impossible," Dr. Matthews said during our team meeting that afternoon. "Patients in deep comas don't retain memories. They especially don't retain memories of events happening outside their immediate environment." Dr. Vasquez nodded. "I've never seen anything like this in 20 years of critical care medicine." But the impossibilities were just beginning. Thomas's neurological recovery was unprecedented. Patients who suffer 8-minute cardiac arrests typically have severe permanent brain damage. Those who do recover usually require months of rehabilitation and often have significant cognitive impairment. Thomas Kellerman showed no signs of brain damage whatsoever. His cognitive function was not just normal, it was enhanced. He could perform complex mental calculations faster than most people could with a calculator. His memory was perfect, not just for recent events but for his entire life. He could recall conversations from decades earlier word for word. "Run every test," Dr. Vasquez ordered. "I want to understand what we're dealing with." Over the next week, Thomas underwent every neurological assessment available. Brain scans showed no signs of oxygen deprivation injury. Mental function testing revealed cognitive abilities in the 99th percentile across all domains. Blood work showed no abnormalities, but the most disturbing discovery came when we reviewed the continuous brainwave monitoring that had been running throughout his coma. The recordings showed something that should have been impossible. During the 3 days Thomas had been unconscious, his brainwaves had shown patterns consistent with normal sleep, not coma. More specifically, they showed periods of rapid eye movement sleep, the stage associated with dreaming and memory formation. It was as if his brain had been fully functional while his body remained unresponsive. "This violates everything we know about consciousness," Dr. Matthew told our medical team. "You can't have normal sleep patterns in a patient with severe brain injury. You can't have memory formation in a comatose patient." Dr. Vasquez was equally baffled. His cardiac arrest was real. The lack of oxygen to his brain was real. The brain damage should have been irreversible. But what happened next made the medical impossibility even more disturbing. Thomas didn't just remember everything that had occurred during his coma. He began demonstrating knowledge of things that were happening in real time throughout the hospital, things he couldn't possibly know from his bed in room 314. During Dr. Matthews' examination, Thomas suddenly looked toward the door and said, "The woman in room 322 just woke up from her surgery. She's confused and trying to pull out her breathing tube. Someone should check on her." Dr. Matthew and I looked at each other. Room 322 was at the other end of the intensive care unit, and we had heard no alarms. But when I called the nurses' station, they confirmed that the patient in 322 had indeed just awakened and was agitated. "How did you know that?" Dr. Matthew asked. "I can sense it," Thomas replied. "It's like I'm connected to everyone in this building. I can feel their consciousness, their states of awareness." Over the next few days, Thomas made similar observations. He knew when patients in other rooms were experiencing pain before they called for help. He knew when family members were arriving in the parking garage before they reached the hospital. He seemed to have developed an awareness that extended far beyond normal human perception. "Room 318, he said during one of my shifts. "The elderly woman with pneumonia. Her breathing is going to deteriorate in the next hour. You should increase her oxygen support now." I checked with the nurse caring for room 318. The patient, Helen Morrison, seemed stable, but when I suggested increasing her oxygen support as a precaution, her condition improved noticeably. "How do you know these things?" I asked Thomas. "During those 3 days," he said, "I wasn't just unconscious, I was in a place between life and death, where consciousness exists without the limitations of a physical body. In that space, I could perceive the electrical patterns that connect all living minds. Every thought, every emotion, every decision creates ripples in what I can only describe as a vast web of consciousness." "What kind of connections?" "Imagine if you could see the electrical activity in every brain as threads of light extending beyond the physical body. During my coma, I learned to read those threads, to follow them and understand the patterns they create. When someone is in pain, their consciousness generates specific frequencies. When they're about to make decisions, the patterns shift in predictable ways." I stared at him, trying to process what he was telling me. "You're saying you can see people's thoughts?" "Not thoughts exactly, but the energy patterns that thoughts create. Every brain is like a radio transmitter, constantly broadcasting signals. Most people can't detect these signals, but whatever happened to me during those 8 minutes of death opened up that ability." Thomas explained that, during his cardiac arrest, when his brain was supposedly dying, his consciousness had separated from his physical body and entered what he described as a realm of pure awareness. "It's like being unplugged from a single computer and suddenly having access to an entire network," he said. "I could sense every conscious being in the hospital, their emotional states, their physical conditions, even glimpses of their memories and intentions." "But you came back," I said. "I chose to come back. But when my consciousness returned to my body, it brought this ability with it. Now I can perceive those same patterns while I'm physically alive. I can see the connections between minds, the way decisions and emotions ripple through groups of people." He gestured toward the window overlooking the intensive care unit. "Right now, I can sense the anxiety of the family in the waiting room, the fatigue of the night shift nurses, the confusion of the patient in room 319 who's starting to wake up from sedation. It's all connected in patterns that most people never see." The medical team was completely at a loss. Thomas's recovery was not just complete, but seemed to have enhanced his cognitive abilities beyond normal human parameters. His cardiac function had returned to normal faster than should have been possible. His neurological function was demonstrably superior to baseline. Dr. Vasquez called in consultants from the University of Arizona Medical School. Neurologists, cardiologists, and psychiatrists examined Thomas, but none could explain his recovery or his apparent enhanced perceptual abilities. "Have you considered that he might be making educated guesses about these other patients?" Dr. Amanda Foster, the consulting psychiatrist, suggested during one of our team meetings. "How do you make an educated guess about a patient waking up from anesthesia in a different part of the hospital?" Dr. Vasquez replied. Dr. Foster had no answer for that. What made Thomas's case even more unsettling was his apparent lack of concern about the medical impossibility of his condition. When doctors questioned him about his enhanced abilities, he responded as if they were perfectly natural developments. "Don't you think it's strange that you can sense things happening to people you've never met?" Dr. Matthew asked during one examination. "Everything is strange if you think about it long enough," Thomas replied. "Is it stranger than consciousness existing at all?" Is it stranger than the fact that electrical impulses in our brains create thoughts and emotions? What I experienced during my cardiac arrest just revealed connections that were always there, invisible to normal perception. Thomas went on to explain his theory about how these connections worked. Think of consciousness like light, he said. We know light exists as both particles and waves, depending on how you observe it. Consciousness might work the same way. Normally we experience it as contained within our individual brains, like particles. But during my near-death experience, I perceived it as waves, as interconnected fields of energy that extend far beyond our physical bodies. And you can still perceive these fields now? Dr. Matthew asked. To some extent, yes. It's like having a new sense organ. Just as your eyes detect light waves and your ears detect sound waves, I can now detect consciousness waves. I can sense the emotional and physical states of people around me. And sometimes I can see the patterns that indicate what's likely to happen next. His philosophical responses made it difficult to assess whether he truly understood the magnitude of what had happened to him, or whether his brain injury had affected his judgment in ways that weren't immediately apparent. On December 1st, 13 days after his heart attack, Thomas Kellerman was medically cleared for discharge. His heart function was completely normal. His neurological testing showed enhanced cognitive performance across all measured domains. There was no medical justification for keeping him in the hospital. But the night before his discharge, something happened that convinced me I was dealing with something beyond medical explanation. I was working the late shift when Thomas asked to speak with me privately. His wife and daughter had gone home for the evening, and the intensive care unit was quiet. "Daniel," he said, "I need to tell you something I haven't told the doctors." "What's that?" During those 3 days in the coma, I didn't just develop the ability to sense what's happening now. I learned to perceive what you might call probability streams. When enough consciousness patterns align in certain ways, they create visible paths into the future. I felt a chill run down my spine. "What do you mean?" "Every decision every person makes creates ripples in the consciousness field. When you track enough of these ripples, you can see where they're likely to converge. It's not exact, because people can always change their minds, but the major patterns are usually reliable." That's impossible. So is my recovery. So is my ability to sense what's happening in other parts of the hospital. But here we are. He looked at me with an expression that seemed far older than his 42 years. During my near-death experience, I saw time differently. Past, present, and future weren't separate things. They were all part of the same consciousness pattern. When I came back, I brought some of that perception with me. Thomas explained that he could see what he called decision trees, branching paths that showed the likely outcomes of current choices and behaviors. "Right now, I can see several possible futures for you, Daniel. In most of them, you leave nursing within the next few months. The patterns of doubt and questioning that I can perceive in your consciousness are too strong to ignore. You're going to realize that what you've witnessed here changes everything you thought you knew about the nature of consciousness and death." I started to protest, but he held up his hand. "You're going to try to dismiss what I'm telling you. You're going to tell yourself that I'm just making predictions based on your behavior. But you know that's not true. You know that something happened to me that medical science can't explain." He was right. I had been having doubts about continuing in intensive care nursing, thoughts that I hadn't shared with anyone. The experience with Thomas had made me question everything I thought I understood about consciousness and death. "What about you?" I asked. "What are you going to do with these abilities?" Thomas smiled, but there was something unsettling about his expression. "I'm going to follow the patterns wherever they lead. I can see connections between events that most people miss, probability streams that reveal hidden relationships between seemingly unrelated things. There are people and situations that need someone who can perceive what's really happening beneath the surface." That sounds dangerous. Maybe, but death doesn't frighten me anymore. I've been there, and I came back changed. Now I understand that consciousness is far more complex and interconnected than we believed. Individual death is just a transition, not an ending. The consciousness field continues, and now I can navigate it while still being alive. Thomas was discharged the next morning. I watched him walk out of the hospital with his wife and daughter, and I knew I would never see him again. But 3 weeks later, I heard from Jennifer Kellerman that Thomas had left home. He said he had opportunities to explore, she told Dr. Vasquez during a follow-up call. He promised he would stay in touch, but I haven't heard from him since. What disturbed me most was that Jennifer seemed calm about her husband's departure, as if she understood something the rest of us didn't. I started having problems sleeping after Thomas left. I found myself lying awake, wondering about the nature of consciousness, about what might be possible during the transition between life and death. I began to question whether the patients I cared for were truly unconscious, or whether they were experiencing realities that we couldn't detect. The final incident occurred 6 weeks after Thomas's discharge. I was caring for a cardiac arrest patient who had been unconscious for 2 days when I found myself staring at his monitors, expecting him to suddenly open his eyes and demonstrate impossible knowledge about his surroundings. When that didn't happen, I felt both relief and disappointment. I realized that Thomas Kellerman had fundamentally changed how I understood my profession, and I could no longer work in critical care with the confidence and certainty that the job required. This morning, I submitted my resignation letter. In 2 weeks, I'll be starting a position at an outpatient clinic where all the patients are awake and responsive. No more unconscious patients, no more questions about the nature of consciousness, no more wondering what impossible transformations might be occurring in the minds of people balanced between life and death. I'm a good nurse. I've saved lives and comforted families during their worst moments. But I can't continue working in intensive care, knowing that everything I thought I understood about consciousness might be wrong. Thomas Kellerman died for 8 minutes and came back with abilities that shouldn't exist. Whatever happened to him during those minutes when his brain was supposedly dying, it changed him into something that modern medicine can't explain or categorize. I don't know where he is now or what he's doing with his enhanced awareness, but I know that his case challenges everything we think we know about the human mind and the nature of consciousness itself. And I know that somewhere out there, a man who died and came back different is using abilities that medical science says are impossible, seeing patterns and connections that the rest of us can't perceive, living in a reality that extends far beyond what we understand to be humanly possible.